Welcome. This is a video explainer on why healthcare is so expensive. This is a project of CT Healthcare Explained. I am Ellen Andrews from the Connecticut Health Policy Project. Connecticut residents spend more on healthcare than most Americans, but our costs are similar to nearby states. In good news, Connecticut's per-person healthcare costs are growing much less quickly than other Americans and residents of comparator states. From 2013 through 2019, Connecticut's per-person cost annual growth rate was 1.8%, lower than all but 8 other states. In 2014, Connecticut residents paid the 7th highest per-person healthcare costs, but by 2019, we were down to 11th among states. However, despite our high spending, we aren't getting healthier. Americans live 4 years less than residents of other developed countries, but we spend 177% more per person on healthcare than other countries. 6 in 10 Americans rate the quality of care in the United States as average or below average compared to other countries. Health insurance premiums are rising far faster than household incomes in Connecticut as in the rest of the country. Between 2008 and 2021, Connecticut median household incomes averaged 1.9% increases annually, while single and family plan premiums in our state averaged 3.8 and 4.6% hikes, respectively. In 2020, healthcare consumed 16 cents of every dollar in Connecticut's economy, up from 11 cents in 2000. 1 in 8 Connecticut workers is employed in healthcare. Rising healthcare costs are not just squeezing family budgets, but also government and business spending. It's displacing other important economic priorities like education, business investments, wage increases, and unfortunately also public health, which could bring down costs by preventing disease. The latest federal National Healthcare Quality and Disparities Report from the Agency for Healthcare Research and Quality is not flattering for Connecticut. Across 159 measures of quality, Connecticut's performance was just average. In even worse news, we aren't getting any better over time. All but one Connecticut hospital is being fined by Medicare because too many patients need to be readmitted after they've been discharged. Connecticut women are 8% more likely than other Americans to have had breast cancer diagnosed at an advanced stage. And Connecticut residents are 7% more likely to die of a heart attack. Prices are the problem. Healthcare prices are rising far faster than the rest of the economy. From 2002 to 2022, inflation for the entire U.S. economy was 2.4%, but inflation for medical prices was up 3.4%. From 2017 to 2021, Connecticut employer-sponsored healthcare spending for inpatient care rose 21%, while utilization of care dropped by 2%. Spending also rose faster for healthcare professional services and prescription drugs than our use of that care. The causes include higher prices for new drugs and treatments, growing wasteful administrative costs, and consolidation of the entire healthcare market, creating monopolies that can jack up prices. Hospitals account for both the largest share of Connecticut per person healthcare spending and the largest contributor to increasing costs. From 2005 to 2019, hospitals were about 1/3 of per person spending in our state, but were responsible for almost 2/3 of the increase in costs. Physician services accounted for about 20% of both total per person costs and for the growth in costs. Prices vary significantly. There is great variation in prices for equivalent healthcare in Connecticut. A 2022 investigative report by a journalist at Hearst, Connecticut newspapers found that prices paid by different insurers at different hospitals varied widely. The price of a first trimester ultrasound varied from $53 to $1,164 between hospitals in Connecticut, but C-section prices also varied at the same hospital from $1,040 to $8,274. Across the state, growth in the cost per hospital discharge adjusted for the health of the patient and the complexity of their conditions, CMAD, from 2015 to 2019 varied more than tenfold between hospitals. Research is also clear that, unlike in other parts of the economy, better quality care doesn't correlate with higher prices. While it was one of the main goals of the Affordable Care Act, the ACA hasn't controlled healthcare costs. General economic trends have far more influence on healthcare spending than the ACA did. While the Affordable Care Act led to coverage for 126,000 more Connecticut residents, it had little impact on the total rate of growth in per-person healthcare costs. Connecticut's per-person costs were growing fastest before the 2008 recession and fell the most sharply after. Since passage of the ACA, both state and federal policymakers have struggled to control costs. That struggle results from the differences between healthcare and the rest of the U.S. economy. Monopolies for drugs under patent protection can demand whatever price they want. Drug companies use patent protections and other regulatory mechanisms to keep prices high. New drugs are being discovered every week. Some are innovative game changers that treat diseases we have no answers for, such as Alzheimer's, but some are no better than the old drug they replace that's losing patent protection. Huge health systems have big incentives to merge into bigger and bigger systems, and then without competition, they can demand higher prices. Administrative costs, especially in large health systems, are growing faster than spending on medical care. And government has not kept up with the challenges to healthcare to protect competition and keep prices down, or to ensure the quality of the care we get is worth the cost. Hopefully, this has helped explain why healthcare is so expensive in Connecticut. For more information, visit our healthcare cost chapter in CT Healthcare Explained. That's at cthealthexplained.org.